A very good afternoon to all of you. Myself, Dr. Richa Sinha, Department of Community Medicine, Government Doon Medical College, Dehradun, extend a very warm and cordial welcome to all of you in today's continuing medical education session on breastfeeding, organized under aegis of IPHA Uttarakhand. As we observe Breastfeeding Week, our goal is to raise awareness about the benefits of breastfeeding and provide valuable insights and knowledge to healthcare professionals to support breastfeeding mothers. The theme for Breastfeeding Week 2024 is Closing the Gap, Breastfeeding Support for All. We are overwhelmed by the response to the CME as more than 550 participants from all over the state and from different streams of the like medical, paramedical, nursing, management, biosocial, and even engineering students have enrolled for this CME. And the importance of rising trends of non-communicable disease in the community. Now, without much taking time, I would like to request our public health expert, Dr. Ruchi Joel, ma'am, professor in the Department of Community Medicine, Himalayan Institute of Medical Sciences, SRHU, to brief us about the objectives of the workshop.
Thank you, Richa. Good afternoon, everyone. Welcome to the CME on the role of breastfeeding in the prevention of non-communicable disease. As we all know, non-communicable diseases like cardiovascular disease, diabetes, and certain cancers are major health concerns worldwide. While lifestyle changes and medical treatments are often emphasized for their prevention and management, early life nutrition, particularly breastfeeding, is being increasingly recognized as a crucial step in reducing the risk of developing NCDs later in life. Breastfeeding provides a unique and essential form of nutrition that benefits both infants and mothers. Extensive research has shown that breastfeeding is linked to a lower incidence of various NCDs, laying the foundation for long-term health and well-being. In this session, we'll delve into the scientific evidences that highlight the protective effect of breastfeeding against many NCDs. We'll explore the biological mechanism behind these benefits and discuss strategies to promote and support breastfeeding in our community. The goal of this CME is to enhance our understanding of how breastfeeding can be a powerful tool in preventing NCDs, as well as to equip healthcare professionals with the knowledge and resources needed to advocate for and implement breastfeeding-friendly policies and practices. So let's begin this journey towards better health, starting from the very beginning of life. Thank you.
Thank you, ma'am. Now we have Dr. S.D. Kanpal, sir, who is President of IPHA Uttarakhand branch, and I think sir will be joining us shortly. Till then, I would request Dr. A.K. Srivastava, sir, who is Joint Secretary, IPHA UK branch. Sir is currently Professor and Head in the Department of Community Medicine, Himalayan Institute of Medical Sciences. And I request sir to share his views on the today's topic. Srivastava, sir. May I request Srivastava, sir?
Yeah.
Okay. Yes, sir.
Yeah. Thank you, Dr. Richa, for inviting me for this CME. Am I audible?
Yes, sir, you are audible, sir.
Thank you. It has been a very long time since IPHA has started this event, and it has been a long time since IPHA has started this CME, and I am happy to see so many people attending this CME. I hope we will continue this venture again. And today's CME, the theme of this is closing the gap. And Dr. Vartika has aptly chosen the title of how to prevent this NCD through breastfeeding. And we'll deliver the talk on role of breastfeeding on this prevention of NCD. I would also like to give 2 to 3 things that breastfeeding support should be given to all. That is the main aim. So we should think of giving child care leave also apart from the maternity leave that is being given to the pregnant mothers or lactating mothers, so that she can aptly breastfeed her child for at least another 6 to 12 months. And then also we can give the advocacy that go for advocacy that since most of the families are usually nuclear, so they parental leave can be given also to the father or the paternity leave. So this can be given and support to the mothers so that they can take ample rest and the child can be taken care for. So I will request Dr. Bhartika Madam to kindly put this policy also so that this can be taken up further up and in private hospital also or in private colleges also where the working mothers are there, they can aptly feed their child accordingly. So breastfeeding can help in reducing the NCD as shown time and again, and proven evidence is also there. Thank you for Richa, and we can continue. Thank you.
Thank you, sir, for your valuable suggestions. Now I would like to invite Dynamic Secretary of IPHA UK branch, Dr. Pradeep Agarwal, who is an additional professor in the Department of Community and Family Medicine, AIMS Rishikesh, to say a few words of wisdom.
Thank you, everyone, first of all, for joining us. And we have been a part of the IPHA. We are part and we will be the part of IPHA. This is just an initiative and under the leadership of Madam Sanghmitra Ghosh and charisma of Madam Vartika regarding the topic that have been aptly taken up. She has been not only a fellow, she is a master trainer for Breast Promotion Network of India. So with these words, I would like to request the host to take up the further the activities.
Thank you. It's a matter of distinct honor and privilege to have among us the president of IPHA, Dr. Sanghmitra Ghosh Madam, who is an eminent personality in the field of public health. I would request Madam to say few words of wisdom.
Good afternoon and greetings from Indian Public Health Association headquarters. Thank you, Dr. Pradeep Agarwal. Thank you, Dr. Vartika Saxena. And thank you, Deepshikha. Breastfeeding is a cornerstone of public health, offering extensive benefits that span across nutritional, immunological, economic, and social dimensions. By ensuring infants receive optimal nutrition and protection, reducing healthcare costs, and fostering stronger family and community connections, breastfeeding plays a crucial role in promoting overall public health and well-being. So, Indian Public Health Association is observing this breastfeeding week from 1st to 7th August in different establishments, in hospitals, in institute, even in colleges. Today also we have done already two seminars, one in general college, graduation college, and other one is state family welfare for the nursing teachers. So it is actually observed by all the branches, and thanks to Dr. Pradeep Agarwal that they have thought of this type of observation for whole Uttarakhand, and I'm congratulating all the organizers and especially Dr. Vartika Saxena Madam. IPHA, I believe there are non-members also here in the audience. I'm just inviting all of the non-members, all of the audience to be member of Indian Public Health Association, because it is a multi-professional association. It's not only for the doctors and for the community medicine. It is for the nursing officers, the paramedical staff, and those who are working in the public health. So I'll be very happy if we get some new members from Uttarakhand who are interested in public health and who will be taking this, our achievement, all these activities further. So breastfeeding, myth is breastfeeding is very easy, but babies are born with a reflex, obviously, to look for their mother's breast. But many mothers need practical support with positioning their baby and continuing the breastfeeding exclusively up to 6 months. So takes time. This is requires some knowledge and awareness, and it is time intensive. So mother needs space and support, and this support will close the gap. This support is not only for our patient or our mothers, not only for, and it is for us also, those who are working mothers, professionals, those who are working with us. They should have paid maternity leave. They should have feeding time, feeding break time, and also for the pumping, breast pumping and privacy. So everything will be discussed by madam. So I'll just take leave from this, and thank you everybody. Keep it on. Thank you.
Thank you, ma'am, for those enlightening words of wisdom. Thank you once again, ma'am. I would like to request Dr. Kaushik Mitra, Secretary General IPHA, to say a few words.
Thank you. Good afternoon, all of you. A warm good afternoon to Dr. Pradeep Agarwal, who is the main initiator of this today's CME. And I welcome you all, Dr. Deepshika, Dr. Richa, and obviously Dr. Vartika Saxena ma'am, from whom all of us like to hear about her insights. And on behalf of Indian Public Health Association, we would like to say that all over the country, we have invited everyone to celebrate or to observe this World Breastfeeding Week from 1st August to 7th August. And most of the branches are observing it in any way or the other, because this World Breastfeeding Week is a campaign that aims to inform, anchor, engage, and galvanize action on breastfeeding and other related issues. Based on this theme of today, that is today or this World Breastfeeding Week, that is closing the gap and breastfeeding support for all. As we know, there is a lot of inequality regarding breastfeeding, and our aim is to close this gap. And for closing the gap, we need support. We all know that breastfeeding can be linked to all of the 17 SDGs or Sustainable Development Goals of the United Nations. And by closing the gap, we will be nearer to the goal by 2030. So we require support and solidarity. And we should emphasize that not only the breastfeeding mother, but the families, communities, societies, and healthcare professionals can support the breastfeeding mother. So let us collaborate, let us close the gap, let us support the breastfeeding mothers. With these words, I think we would like to hear next from the speaker of the day, that is Vartika Saxena ma'am. And thank you all. And I wish IPHA UK branch a great success for this program. Thank you all.
Thank you, sir. Is the slides visible?
Richa, this is end of the slideshow. Go to the first slide.
Okay, ma'am. Now is it visible?
Yes, yes.
Okay. We are extremely privileged and delighted to have among us Dr. Vartika Saxena ma'am, who is Professor and Head Department of Community and Family Medicine, AIMS Rishikesh, as the guest speaker of the event. Madam was former Dean Research at AIMS Rishikesh and is a visiting professor of University of 25 years of professional experience in public health, especially in adolescent health, maternal and child health, nutrition, and non-communicable diseases. And Madam has worked under various national and international agencies for improving health status of outreach and underprivileged communities. Ma'am is a member of National Task Force for Adolescent Health Program, Rashtriya Bal Swasthya Karyakram and Iron Plus Initiative, and has served for 3 years as nutritional consultant in UNICEF. Madam has more than 150 research publication in national and international journals, and she has implemented more than 50 extramural and intramural projects funded by various agencies like WHO, ICMR, and UCOST. And Madam has been awarded as Best Teacher of the Year in 2023, Best Researcher Award for having highest number of extramural grants in AIMS Rishikesh in year 2023, and also awarded a certificate of excellence for outstanding work and significant contribution in creating awareness and sensitization during COVID pandemic in AIMS Rishikesh. And she is also awarded by Shri Siddhinath Avasthi Memorial Award for outstanding gem of any batch who has done exceptional work in rural areas for community welfare and health in Kanpur, Uttar Pradesh. Now, I would like to request Madam to enlighten us with her views on today's CME, role of breastfeeding in prevention of non-communicable diseases. Over to you, ma'am.
Thank you so much. And thank you, special thanks to Dr. Richa for my elaborate CV presentation. I think I can start with sharing my slides so that it goes smoother.
Yes, ma'am.
Is it visible?
Yes, ma'am, it's visible.
Yes, ma'am.
Okay. So first of all, I would like to express my gratitude and thanks for taking me on board for this CME, because this is really very, very near to my heart. And I would like to thank national leadership of IPHA, Dr. Sangmitra Ghosh, and also the state leadership of IPHA, SD Kantpal sir, and all the organizers, Dr. A.K. Srivastava, Dr. Pradeep Agarwal, Dr. Richa, Deep Shikha, Dr. Ruchi Joel, and Dr. Kaushik Mitra for expressing and showing their solidarity for a very important cause, which is breastfeeding. Because I have been working in this area for last many, many years. So I know how much this is important, how much this is important to share this knowledge with our colleagues as well as our budding doctors and juniors. We all know that this is a week which is being celebrated by all the community and family medicine department, all the community medicine department in the state medical colleges and central institutes. So as a head, I'm very happy to share with you all that we have also celebrated this week with the zeal, and continuing celebration are going on in the department. We have done a poster competition, and today in the morning we had a sensitization of frontline workers. We have done role plays in collaboration with the nursing colleges, and many more activities are lined up for next few days. So we all would agree that this is something we all must continue, not only during this week, but it has to be continued during the whole year, and intensive efforts are needed. So now coming to my topic, which is about the role of breastfeeding in prevention of NCDs. I just would like to share that a couple of years back, when I was working in the area of non-communicable diseases, and my area of interest at that moment was hypertension, I have realized that in this area of Uttarakhand, especially in Dehradun district, the prevalence of hypertension came out to be around 36%. Now 36% is such a high prevalence of hypertension that I was wondering that why NCDs are means exploding the areas, why this much of high intensity of NCDs are rising in the country and the state. That time I already knew that breastfeeding has to play a very important role for curbing it down, but I was wondering what is the biological plausibility, how breastfeeding can link to BNCDs. So at that time I searched a lot, I reviewed many papers, literature, and actually this presentation is nothing but my notes of my search for understanding the role of breastfeeding in non-communicable diseases, which is I'm very, very happy to share with you all. So in this presentation, I'll be talking briefly about the IYCF indicators being a breastfeeding week. This is very important to touch upon few of the indicators. Then I will talk about little in very brief about NCD indicators and its risk factors. And then I will showcase how what is the biological and epidemiological evidences available to showcase role of breastfeeding for prevention of NCDs and its risk factors. The first indicator, which is very important for all of us to understand, is how many of our children they are able to start breastfeeding within 1 hour of birth. And you can say these blue bars, which show the national level figure, you can say less than 50%, less than 50% of children they are being initiated on breastfeeding within 1 hour, and this is this inversely indicate that 60% of children are not getting breastfeeding within 1 hour. And you know what are the consequences. Hope all of you know that breastfeeding within 1 hour is not only important for the child, but it is also important for mother, for the evolution of uterus, decreasing the uterine bleeding. So you can imagine what is the condition at the moment. If you look at the status of Uttarakhand, you can see that in our state also more than 60% children are not being initiated on breastfeeding within 1 hour, although state is showing a remarkable rise around 13.5 points rise in children being initiated on breastfeeding, but still we need to work a lot in this indicator. The next important indicator as far as breastfeeding is concerned is 6 monthly exclusive breastfeeding. You can see that at national level we are performing fairly well, with more than 60% children are being given 6 months exclusive breastfeeding. But if you look at the status of Uttarakhand, we are 11.2 points behind the national level, and this is the area we all need to collaborate to work hard, because exclusive breastfeeding is again an indicator which is linked with the survival of babies. The next important indicator is how many of them they are being initiated on the adequate diet. Hope all of you understand, in reference to breastfeeding, adequate diet means adequate frequency of feeding, and ensuring minimal food diversity, which means that at least 4 groups of foods are being given out of total 7 to 8 foods which are there in the plate of household plate. So you can see that at national level only 11.1% children are being put on the adequate diet, although Uttarakhand is performing better than the national average, but still you can see we are not performing to the expectation. And again, I would say this is the indicator where a lot of work is needed. I have also conducted multiple studies in this area, and one indicator which I would like to emphasize out of my studies that I have found in this area, around 22% infants were given pre-lacteal feeds, and consequences of pre-lacteal feed, which is linked with the neonatal mortality, and 20% were bottle fed. Again, an indicator which indicates that it can raise the prevalence of respiratory and diarrheal diseases. So, and the important point which we need to consider and work hard for reducing the situation or making the situation better. Now coming to the NCDs indicator, all of us, we are aware, it's just a repetition of our understanding that 74% of the global deaths are being contributed by NCDs, and 86% of these are premature death. Premature death means a person is dying before 70 years of age. And in our out of these deaths, cardiovascular, diabetes, chronic respiratory, and cancer, they all contribute around 80% of all premature death globally. So we know that the kind of mortality which is happening because of this. In our own country, 1 out of 4 Indian has the risk of dying from NCDs before 70 years of age. So if 10 people are sitting over here, I would say 3 of us are at risk. Now, as far as diabetes is concerned, you can see that in our Uttarakhand, the orange bar shows Uttarakhand status. Diabetes is lesser prevalent as far as national average is concerned, both male and female. But look at the hypertension situation. Both in male and female, our hypertension prevalence is much, much higher than the national average. And this is the cause of concern. In males, it is around 31.8%. So we need to understand what are the reasons and what could be the preventive tool to change the scenario. And the one more most important risk factor for NCDs is obesity and overweight. Now look at these orange bars. They are much higher than the blue bars. Means our prevalence is much higher than the all India average. And look at the comparison of male and female. Women are much more obese in comparison to male. And the trend which I have observed in one of my research, that obesity is rampantly exponentially rising amongst women, and I presume that if it is not being controlled, it can lead to the exploding situation of NCDs amongst women. So we need to be very, very careful about these trends. And then breastfeeding comes as a very important preventive tool if we want to talk about the curbing down the NCDs. Now, to understand how breastfeeding is linked to the NCDs, we need to understand the constituents of breast milk. You can see the energy level in the human milk is little more than what is there in cow's milk, but the protein level is almost 1.3%, is almost 1/3 of what is there in cow's milk. It is 1.3 and here it is 3.3. And as far as fat is concerned, you can see our fat in the mature human milk is little more than what is there in the cow's milk. And another constituent which is linked to the series is sodium. Look at the sodium. Sodium is only 15, whereas it is 55 in cow's milk. So mature human milk has a very less amount of sodium. And these constituents, I'm just going to show you how they affect the prevalence of NCDs in coming or later part of the years. So let us talk about the role of breastfeeding in overweight and obesity. There are many mechanisms given by different studies. So first mechanism says that if breastfeeding is there, it establishes the feeding routine of the baby. So if there is a routine of feeding that regulates the infant's appetite and satiety. So time पे baby को भूख लगेगी और time और उसको breast milk मिल जाएगा तो satiety आ जाएगी. So this kind of regulation actually ensures a kind of balance in child's appetite in the later years of life, and this balance is responsible for decreasing the overweight and obesity in adulthood. So this is the first mechanism. Other mechanisms are like this, that protein content, I have shown you the protein content in the breast milk is lower. So this lower protein content decreases the secretion of insulin growth factor type 1, and which results into the less stimulation of adipocytes and deposition of fat, which results into the lesser weight gain. The third mechanism is that because leptin is a very important constituent which is present in the breast milk, which leads to decrease in the growth factors, further reduces the stimulation of adipocytes, so less fat deposition. Leptin also affects the insulin growth factor and further leading to lesser stimulation of adipocyte. So these are the three broad mechanisms how overweight and obesity is prevented if child is being adequately breastfed. And now let us see what is the relationship of breastfeeding with hypercholesterolemia. Now, there are two mechanisms for this. The mechanism, according to first mechanism, you can see, I have shown you that there is a high fat content in the human milk. And this high cholesterol content of the milk, it has a long-term programming effect on the blood cholesterol level. And this leads to the down regulation of hepatic hydroxymethylglutarate coenzyme A, which reduces the synthesis of cholesterol in the body and further lowers the cholesterol level in the old age. So this is the mechanism how cholesterol level is lowered in the body. The other mechanism is very simple, that breastfeeding affects the appetite and satiety, as I have discussed, which leads to the better eating habits in the later life of life. And if you have a better eating habits, you are not munching all the time, you are not taking fried foods, and if you get satiated with the moderate amount of the food, definitely it will decrease the cholesterol level in the older age, or there lesser chances of increasing the cholesterol level in your body. So these were the mechanisms for cholesterol moderating effect. Now let us see what is the relationship of breastfeeding with the hypertension. Now, as per the mechanism 1, I have said that in breastfeeding, if the person is on breastfeeding, which has a reduced sodium in the milk, which leads to the lesser sodium intake in the infancy. And if you are taking lesser sodium during infancy, which results into the lower systolic and diastolic pressure in later life also. The other mechanism is that blood pressure is directly correlated with the body weight, and breastfeeding prevents the obesity. If the obesity is not there, chances are that your blood pressure will be lower. So these are the important mechanisms for maintaining the appropriate blood pressure. Now, breastfeeding and diabetes. Very important association which I could see, that I have shown that fat content of the breast milk is high. So this breast milk high fat content is constituted by long chain polyunsaturated fatty acid, which are also known as LC-PUFAs. So these LC-PUFAs, they are being constituted by two important long chain fatty acid, that is DHA and arachidonic acid. Hope you all know that DHA and arachidonic acid, these are the two very important amino acid constituent for growth and neuronal growth of baby also. So if they are present in adequate amount, and if baby is able to get them through breast milk, it actually increases the LC-PUFAs in the skeletal muscle membranes, and which results into protection against the insulin resistance and leads to the protection against beta cell failure, which is an important mechanism for developing diabetes. And this mechanism, or you can say this kind of pathway, also further leads to the decreased chances of developing diabetes in later years. The other two mechanisms, there are two more mechanisms which are there, which are very helpful for reducing the chances of developing diabetes in the later year. The first one is that we know that breast milk has a lower content of insulin. And this lower content of insulin actually leads to the long-term programming on glucose metabolism. And this leads to the decreased incidence of diabetes in later years. The third mechanism is that breastfeeding is protective against the risk of obesity in adulthood. And because there are lesser chances of obesity, this influences the insulin and glucose metabolism, because we all know if there is higher amount of obesity, adipocytes, they can lead to the insulin resistance. So obesity is lesser, then very good mechanism. Insulin can easily affect the glucose metabolism, and there are lesser chances of developing diabetes in the later years. So over these slides, you must have seen that the important mechanisms which is playing its role is lesser chances or decreased chances of obesity, which is leading to affecting many other mechanisms. Now, breastfeeding, how breastfeeding is protective for cardiovascular diseases. So we have already seen how breastfeeding stops, or you can say prevents the overweight and obesity. It prevents hypercholesterolemia. It prevents hypertension, developing hypertension. So, and also diabetes. So, which are the risk factor for cardiovascular diseases. So what is the mechanism for breastfeeding and prevention of cardiovascular diseases? You can see because many factors are being affected by breastfeeding, and it has a major protective effect for developing hypertension, obesity, total cholesterol level, and also on LDL cholesterol level. So if breastfeeding can modify these factors, ultimately, consequently, it leads to the lesser chances of developing cardiovascular diseases. Now, a very important point, many times it is not being included as a classical disease and as an NCD, but mental health disorder, they are rising in the society, and we all are very much worried about them. So let us see that how breastfeeding can be protective against the mental health disorder. There are three mechanisms for that. So let us talk about the first mechanism. We all know breast milk contains oxytocin hormone, and it is said that oxytocin also released in the child due to physical contact and warmth during breastfeeding. So this oxytocin has a very important role for reduction of the antisocial behavior and aggression in the later life. So breast milk which contains oxytocin, and the process of breastfeeding while baby is kept in close contact with the mother, both are important for reducing the chances of aggression and antisocial behavior in the later life. So we all must appreciate this. The second mechanism which is very important is that breastfeeding leads to release of oxytocin hormone, and this modifies the effect of estrogen receptor 1, and this modification of the estrogen receptor 1 reduces the depression in the later life. So there are many other steps also. I'm just showing you the summary of what I have deciphered. So this is another mechanism by which depression can be reduced. The third mechanism for reducing the mental health disorder is that breast milk has a lactogenic hormone, and oxytocin and prolactin are being released during the process of breastfeeding. These hormones actually have an antidepressant effect also. So they reduces the anxiety and postpartum depression amongst mothers who are doing breastfeeding. So you can see that breastfeeding is not only important for mental health issues in later part of life for the babies, but it is important also for keeping the mother happy and reducing her anxiety and anxiousness during the postpartum period. So in nutshell, I can say benefits for the breastfed babies, they include reducing the risks of overweight and obesity. It lowers the blood pressure, it lowers the serum cholesterol level, it lowers the risk for type 2 diabetes. It also lowers the prevalence of mental health problems in children and adolescents when they age. And for mother, breastfeeding helps to lose weight. We all know it reduces the ovarian and breast cancer. It reduces her chances of being type 2 diabetic, and also reduces risk for hypertension and cardiovascular diseases, because we all know most of these are linked with the overweight and obesity. And if mother is breastfeeding, she is able to gain her normal weight earlier in comparison to those women who are not breastfeeding. So this breastfeeding is not only important for babies, but it is important for the breastfeeding mother also. So finally, the take-home message is that breastfeeding has a protective role against NCDs, but I would like to say that long-term follow-up studies are required for strengthening the existing evidences. We do have many evidences, but in some cases we need to further explore the pathways for exact phenomena which is happening for controlling the or preventing the occurrence of these diseases. So that is all from my side. So I thank you all for patient listening. Thank you so much.
Thank you, madam. It is always delight to hear from you. And thank you also once again for expressing your opinions in such details and outlining the value of breastfeeding as a preventative measure against a number of non-communicable diseases. So I thank you once again, ma'am. And now I would like to invite Dr. Deepshikha, who is Associate Professor in the Department of Community Medicine, Himalayan Institute of Medical Sciences, to conclude the CME with the vote of thanks.
Thank you, Dr. Richa, for coordinating the CME so well. Esteemed guests and participants, as we conclude this insightful and enriching CME session on Breastfeeding Week 2024, on behalf of organizing committee, this is my privilege to extend a heartfelt vote of thanks to all those who have contributed to making this event a resounding success. Firstly, I would like to express my deepest gratitude to our esteemed President IPHA, Dr. Sanmitra Ghosh ma'am, for her unwavering support and guidance. Your leadership and vision have been instrumental in the success of this. I also extend my thanks to Dr. Kaushik Mitra sir, our dedicated Secretary General of IPHA, for his meticulous planning and organization for seamless execution of this CM. I extend my sincere appreciation to the President of IPHA Uttarakhand branch, Dr. S.D. Kandpal sir, and our Secretary, Dr. Pradeep Agrawal sir, for their invaluable guidance and continuous support. Their presence has been crucial for reinforcing the relevance of the topic discussed today. We extend our sincere gratitude to Dr. A.K. Srivastava sir, Joint Secretary IPHA, for his unwavering dedication and tireless efforts in ensuring the success of this event. A special note of appreciation goes to our distinguished speaker, Dr. Vartika Saxena ma'am, for her enlightening presentation on the role of breastfeeding in preventing non-communicable diseases. Your expertise and insights have provided us with a deeper understanding of this topic, inspiring us to promote breastfeeding as a vital public health intervention. As healthcare professionals and advocates, it is our responsibility to support and promote breastfeeding practices within our communities. I would also like to express my gratitude to the advisors, Dr. C.M.S. Rawat sir, Dr. Vartika ma'am, Dr. Anupama Arya, Dr. Sadhna Avasthi, Dr. Jairaj Hanspal, Dr. A.K. Srivastava, Dr. Puneet Ori, Dr. Kajal Gupta, Dr. Mashroof, and Dr. Aarti Rodhan. And nodal officers like Dr. Janki Bartwal, Dr. Pallavi, Dr. Madhulika Singh, Dr. Rudresh Negi, Dr. Ashutosh Mishra, Dr. Surbhi Mishra, Dr. Shalki Mathas, Dr. Neha Upadhyay, and Dr. Sneha Mittal, representatives of Uttarakhand Medical Colleges, for their contribution and support during the observation of Breastfeeding Week 2024. We are also grateful to our technical support staff, Ankur and Arshdeep, for their hard work and flawless execution of the event. Finally, I would like to thank all the participants for their presence and active engagement to make this CME truly meaningful. Once again, thank you all for your support and contribution. Thank you.
Thank you, everyone. Thank you, respected ma'ams. Thank you.